Hi, my name is Mary. I coach new grads for their first nursing interviews, and today I want to give you my number one tip for those of you who are still in school. Anytime you are in clinicals and you have a situation that you feel like you handled really well, write down everything that you can remember about it that day. I know it feels like you'll remember it forever, but later when you're in an interview and you're super nervous and they ask you, tell me about a time when, you might not have it come to mind, or you might not remember the full story. So write it down day of. So the reason that you want to have these stories in a list that you can pull from is because when you tell the story, they get a picture of you in that scenario that they kind of file in their head. And then later when they're going through the rubric and it's asking them if the candidate showed ability to demonstrate empathy, to de-escalate a situation, they'll recall those images and give you the full points for that question, versus if you throw out all the right key words, empathy, compassion, building relationships, they'll think, well, that was a good answer, but I don't really feel like I know what this person has done in any given situation. And then they feel like they don't trust you enough to know she can handle our specific unit, because they don't have those pictures of you acting appropriately in all these different situations that have been thrown at you. So that's why it's really important as you're a student to write down everything you remember about those situations where you feel like you handled it really well. And this isn't even just only the questions where they want to hear about a patient that was critical. A lot of these questions are about a time when you were able to show kindness to a patient, or, if you had a patient that was really upset and you were able to comfort them. Any time when you feel like you handled something super well, write it down, because it might be a story that you can reference later when you're preparing for your interviews.